I am Dr. Chebet Chepkwony, and I am a physician by training, trained in Kenya. So today I want us to talk about syncope. Another name for syncope is fainting. The layman language is fainting, but in the medical world, it's called syncope. You remember, if you're an 844, we used to go to assembly on Monday morning and Friday morning, and some kids used to faint after standing on the line for like 30 minutes. When the teachers were doing those announcements, people used to faint. So that's what I mean. So, and you need to differentiate fainting from a seizure. A seizure is kifafa in Kiswahili. So it's totally different, but some seizures can present as syncope. And sometimes when you're evaluating, especially young people, young adults, you need to rule out a seizure, okay? So what is syncope? So syncope is a transient, meaning a temporary loss of consciousness. There must be loss of consciousness. And sometimes when you're evaluating a patient, you need to corroborate, you need to ask a bystander, either family, husband, wife, to describe what they saw. And there must be loss of consciousness. Loss of consciousness means you can't arouse them during that episode of fainting. If the patient tells you, I didn't lose, like I saw everything and I could hear everything happening, then that's not syncope. That's something else, maybe lightheadedness or presyncope, but that's not syncope. In syncope, there must be loss of consciousness. It comes rapidly with no warning. So rapid onset, transient loss of consciousness, for a short period of time, few seconds, few minutes, like even 5 minutes, and then there's spontaneous recovery. These people recover and move on with their life like nothing happens. A few people can faint so many times in a day, and that indicates a very dangerous thing that's happening. There's an underlying process that you need to figure out, yeah? So usually when you're taking a history, you ask them, did you feel lightheaded? Did you feel dizzy? Did you feel a blackout? And then if you're trying to differentiate from a seizure, you ask them, did you bite your tongue? Was there foaming in the mouth? Now you're asking someone who witnessed that fall, that fainting. Did they open bowels? Did they urinate on themselves? Did they poop on themselves? Was there a period of confusion when they recovered? Usually, if there was a period of confusion after recovery from fainting, then that could be a seizure, and that's maybe it's not syncope, but it could be a seizure. But if there was no period of confusion, they fall down, wake up, move on with life, then highly likely it is syncope. So causes of fainting can be non-dangerous things, can be benign, or it can indicate a very life-threatening underlying problem that, if not sorted, can lead to sudden cardiac death. So it's always good to take fainting or syncope very seriously in an adult. I'm talking about adults. I don't know about children because I'm not a children's doctor. I'm not a pediatrician. I'm an adult specialist. So causes of syncope are many, but in adults, it is classified into 3 common causes. One is reflex syncope. This is usually mediated by the nerves. It's called neurally mediated. The second cause is orthostatic syncope. Orthostatic means the blood pressure goes down when you stand up. And then the third one is cardiac causes, yeah? So what is reflex syncope? So reflex syncope, as I said, is mediated by the neurons. It's mediated at the brain level. You can get what is called vasovagal syncope. This is the common faint. As I said, remember when we used to stand in assembly for so long and people used to faint? So that comes from prolonged standing. It can come from fear. It can be triggered by pain or acute stress. People just faint because they've received bad news. That can be called vasovagal, and it's neurally mediated. There's another cause of reflex syncope called situational syncope. This is a very funny cause, but it's a very interesting one. So some patients will tell you, I fainted at 3 a.m. when I was urinating. So just the urination triggers nerves, and then you faint. When they are going for number 2, defecation, or if they are coughing. Some people, they cough, they faint, they cough, they faint, or even swallowing. So that is called situational syncope. You get all this from history taking, listening to the patient describe. There's another cause, the third cause of reflex syncope is carotid sinus syncope. So around here is the carotid artery, and then there's a sinus here. Sometimes when it's triggered, especially among the elderly people, when they are shaving, they can stimulate the carotid sinus and then they faint. Or if they wear a tight collar, the pastors, when they wear a tight collar, or even just a tight collar or a very tight shirt, they can faint because of that stimulation. So if a patient tells you, whenever I shave, I just faint, just know that's carotid sinus fainting. The second group, apart from reflex syncope, the second big group is called orthostatic hypotension. So orthostatic hypotension means when you stand up, your blood pressure dips, your blood pressure goes down. It can go from maybe the upper one, the systolic of 120, to, if there's a difference of more than 20 millimeters of mercury on the upper one, or more than 10 millimeters of mercury on the diastolic one, that's a true orthostatic syncope. So some patients, when they stand, if the blood pressure when they were lying down was 100/60, if they stand, the pressure goes down to 80, that's the systolic one, over, let's say 50, the diastolic one. That is orthostatic hypotension. It means that not enough blood is reaching the brain, and that's why they are fainting. And syncope anyway means not enough blood is reaching your brain. So how to diagnose this is, when you're evaluating a patient with syncope and you're suspecting it's orthostatic, you tell them to stand. Of course, you beware, they can fall down, and then you check their blood pressure at 0 minutes, you check at 1 minute, and at 3 minutes standing. You don't let them sit down until you've done 0, 1, and 3 minutes. That's the true checking of orthostatic vital signs. Yeah. This is common among elderly patients. Some of them who are taking high blood pressure medicines. If you don't balance, if the doctor doesn't help the patient to balance the blood pressure meds, they can get orthostatic hypotension. This is maybe from people who are having diarrhea and vomiting and they are dehydrated. There's not enough water in the body. When they stand, the pressure goes down. Then they faint because not enough blood is reaching here. Okay. Some people with neurological problems like Parkinson's disease, advanced diabetes can get this orthostatic hypotension from from the nerves interfering with blood pressure, blood pressure control. So they get orthostatic hypotension. Last but not least common cause of syncope, the third big group, is cardiac causes. This is where all the money is. So an abnormal cardiac rhythm, if the heart rate is too low, the heart rate is too high, some structural problem, like heart rate. I've had a patient coming in with fainting, and I checked their heart rate was 15. So she kept fainting the whole day. She had a complete heart block, and she needed a pacemaker urgently. So we restored that rhythm, and the patient became okay. Some patients have got an underlying structural heart problem. There are some things called cardiomyopathies, called hypertrophic obstructive cardiomyopathy, where the blood doesn't leave the heart into the brain because there's obstruction. Yeah. Some people, when they get a big heart attack, they faint, and that can be a very dangerous sign because their heart can stop. Some valvular problems, some severe narrowing of the aortic valve, because the aortic valve is the one that channels blood out of the heart. It regulates that blood flow into the brain. So severe aortic stenosis or severe aortic regurgitation can lead to fainting. Okay. So as I said, differential diagnosis: seizure, low blood sugar. So take a detailed history from your patient and examine their heart. If there are any murmurs, that could mean there is valvular disease. Do vital signs, blood pressure, heart rate, oxygen saturation, electrocardiogram, full blood count, kidney function test, electrolytes. Do an echocardiogram to see if there's any structural heart problems. Okay, and then some patients can get sudden cardiac death. So you need to help them come up with a diagnosis to start treatment that is life-changing.